Thank you all for coming today. I appreciate that. I also want to say this is my first full day in the office, and we're doing a press conference. I committed to you that I would make myself accessible, and it starts on my first full day here in the office. I will also be releasing our budget later this week, so stay tuned for that. Look forward to discussing that with you. But today I wanted to give you a brief update on COVID-19, specifically some of the decisions we are making and actions we intend to make in the days and weeks to come. You all know this virus has taken the lives of more than 1,000 Montanans, and more than 83,000 Montanans have been infected. The economic impact has left Montanans out of work and without a paycheck, and it's left some Montana small businesses closed for good. But underreported are the other health impacts associated with the pandemic-induced isolation. Increased demands for mental health care, increased cases of suicide, greater drug use and abuse, and more cases of domestic violence and child abuse. These all are tragic. Addressing COVID, as I have said, is my top priority as governor. It's why one of the first things I did after being elected was set up a COVID-19 task force. The task force represents Montana. It's from medical professionals to small business owners, from workers to local leaders. I'm grateful to these members for giving so freely of their time and for their recommendations. Their work and ideas are represented in our plan of action. I've also been getting weekly briefings on COVID and the vaccine distribution. As you know, former Adjutant General Matt Quinn, a member of our COVID task force, will head up our COVID-19 response in the governor's office going forward. This will maintain continuity so that we will not miss a beat at this important time. General Quinn is with us today to help answer some questions when we get to that portion of the press conference. And yesterday, I instructed the members of my cabinet, each of them, to be tasked with leading the COVID response in their respective agencies. And I've asked each of them to make COVID a top priority as they begin the process of reforming how Helena does business. The challenges of the last year, the COVID-19 pandemic and the economic fallout, have left no Montanan untouched. That's why it's important that every state agency does its part to help Montana recover. In the coming days, we will issue new directives and guidance to replace the existing ones. There will be changes. Some guidance and directives will be revised. Others will be removed entirely. Our goal is to make these new directives and guidance very clear. They will be practical and will take into account that while we are in the middle of a public health crisis, we are also in the middle of an economic crisis. Additionally, we will take steps and develop strategies to increase testing access and availability at no cost to all Montanans. We will improve data quality and distribution so that Montanans have a clear sense of where they stand with COVID. This will include adding vaccination numbers and availability to the state's COVID dashboard. I am confident with the introduction of vaccines and increasing testing, we will get a better handle on COVID. Last month, we reached a major milestone when the first shipments of vaccines arrived in Montana. So far, Montana has received 36,000 first doses of COVID-19, and we are slated to receive an additional 41,000 first doses in the coming weeks. As of yesterday, about 23,000 Montanans have received the vaccine and their first dose. These include frontline healthcare workers all across Montana. And we have begun the distribution of vaccines to those in nursing homes and long-term care facilities. In addition, there is a separate and dedicated supply of vaccine being directed to our tribal communities. This is all good news. A vaccine will help us overcome COVID-19, but it must be widely distributed to get us there. We need to provide the vaccine to those that want it. We cannot have vaccines sitting on the shelf. That's why I have tasked DPHHS and General Quinn to begin the process of revising the vaccine distribution plan to prioritize the most vulnerable in our communities. We are currently in the process of working through a system to begin expanding vaccine distribution specifically to the following groups: all Montanans of 70 years of age or older, and Montanans age 16 to 69 that have specific underlying health conditions that make them more vulnerable. I have directed the team to make this change effective immediately. We are opening the lines of communication with local health departments, hospitals, and other healthcare providers to find solutions to get the vaccines to this population as soon as possible. This will not be simple. There will be challenges, but we are committed to prioritize protecting the most vulnerable in our communities next. Since the beginning of the pandemic, Montanans have had to make decisions to do their part to keep the most vulnerable safe. That's why we must do everything we can to get this vaccine to the most vulnerable as quickly as possible. And since you're going to ask about the mask mandate, I fully intend to rescind the existing statewide mask mandate. The path to rescinding the mandate will be clear. First, we need to get going. We need to start getting the vaccine to the most vulnerable. Second, we need to protect businesses and schools from lawsuits if they make a good faith effort to protect individuals from the spread of the coronavirus and follow clear public health guidelines. To combat the virus, I believe providing incentives and promoting personal responsibility are more effective than imposing impractical mandates. After we have increased vaccine distribution, and after I have legislation on my desk that protects businesses, schools, places of worship, and nonprofit organizations that follow guidelines from lawsuits, then we will rescind the current statewide mask mandate. In the meantime, I choose to wear a mask, and I encourage others to do the same as a way to show respect and to care for the people around us. And with that, I'm happy to take some of your questions. Who'd like to go first?
What would be some of the specific metrics that you would need to see to rescind that mask mandate? Are there numbers, percent vaccine distribution, or any sort of real specific benchmarks that you have laid out, or is that still in process of being developed?
Yeah, so good question. I mean, the criteria are very clear. First, we need to get this vaccine out to the most vulnerable. We need to reduce the number of deaths and people impacted by this COVID. And secondly, I think we need to shift from mandates to incentives for people that follow these very clear public guidelines so that they're incented to encourage customers and employees to take precautions to protect their health. Yes?
Do you have an expectation of a timeline of when that mandate will be removed?
So again, we need to get the vaccine out to the most vulnerable. This population group of 70 plus, in certain communities, we're in a position where there's vaccine available. We don't have as much as we want. Again, we'll have about 77,000 doses in the state within a couple of weeks. This second population is about 250,000 people if you take 70 plus underlying conditions. Not everyone decides to take the vaccine. We've seen a certain portion take it up. So we're talking weeks, not months, as we're able to get this vaccine out to the most vulnerable.
Governor Zach Kaplan, Montana, right now. With regard to some of the incentives that you have in mind, would you care to go into detail about some of the things that have been discussed or that you might be implementing with regard to give the incentives for businesses?
Yeah, so the incentive is very clear. I think that it's not just businesses either. It's businesses, schools, places of worship, nonprofits. We want to publish very clear guidelines on how they can keep their employees and customers safe. We're going to do that in the coming days. What we want to do is give these organizations some confidence that if they follow these publicly provided guidelines, they will be protected from lawsuits. And that's really what we're trying to do here with these incentives. And I think we have some questions online too. I'll switch there and then I'll come back if there is one, Brooke. Go back here? Okay, we'll take it from the pool here. Yeah.
Another question about vaccination. The nation is behind in vaccinating people even in their first doses with the COVID-19 vaccine. Is that happening in Montana too? Are we behind on how many people
General Quinn?
Hi, so the question was, where are we standing with the vaccination schedule? I'll tell you, Montana is number 8 in the nation right now in terms of getting shots into the arms. I think we're doing pretty well. Remember, we've got a geography that's pretty diverse, and so the long-term care and assisted living facilities are being done by CVS and Walgreens. That was an opt-in program that the state made. They are getting out to those locations and taking care of those locations. But again, a lot of geography to cover, and so they're moving through that. But I think Montana's doing well. Certainly would like to be at 100%, but number 8 in the nation isn't bad in terms of getting shots in the arms. Okay.
Other questions?
Hi, Governor. Stokel at the Daily Interlake. You emphasized the need for clear, practical public health guidelines and the need to shield businesses. And so I'm curious about the fate of those lawsuits against the 5 Flathead County businesses. I know they're suing back, so that puts the state in a tougher position.
Yeah, one of the things we've heard clearly from
Conference mute.
One of the things we heard clearly from our COVID task force was that there were concerns about many of the restrictions that were placed on businesses. And again, our goal here is to shift to more personal responsibility and less mandates. Many of these guidelines are just impractical in terms of implementing them. So we're gonna shift to ones that are clearly understandable, that allow us to balance the economic impacts with the public health need to protect our neighbors.
In terms of the 2 groups you laid out, the 75 and up, and then the people with pre-existing conditions, do you have an idea of how many people are in those 2 population groups?
Yeah, so good question. Maybe General Quinn?
I don't have that number.
Okay, from our discussions, I can share. This is the 1A category, which is frontline healthcare workers and people in nursing homes and long-term care facilities. That population, about 60,000 in the state of Montana. Again, uptake is not 100%. It's in certain communities, it's 40%, other places 75. We're not, we want to make it available to people that want it. That second category, 1B, becomes people 70 years of age or greater and people 16 to 69 with underlying health care conditions, approximately 250 to 300,000 people. So those are the rough numbers.
And then understanding that pharmacies are working with those populations in congregate care settings right now, for the other groups that you want in that priority, will that be through their healthcare providers? Would it be public health? I'm kind of wondering about how that distribution is, and then how you like to work to increase the uptake in those communities where it is on the lower end of people.
This is a very important question. For people in that group, how do they get a vaccine? So General Quinn, if you could address that.
So I think, Holly, I might have not heard the full question. The question was, where are the individuals going to get the vaccines? And so We are working through public health departments across the state. We're working through the hospitals across the state, the access clinics across the state. And so all of those will come online. We'll look at additional providers. If you think about where you can go get a flu shot, this would be similar to that if we're able to expand that access. But what Governor Gianforte has directed is to expand that access so that Montanans can get the vaccine.
And then in terms of work to get more people willing to take the virus, what sort of efforts do you expect around that?
We've talked to DPHHS about communications programs. I've said myself, when I'm not 70 yet, so I'm not on the list, but when my name comes up, I plan on getting the vaccine, and I encourage other folks that are comfortable to go ahead and do that. We have a question online.
Question from Amy Beth Hansen with the Associated Press. Amy asks, would new guidelines allow county health boards to have stricter standards?
The current law gives broad discretion to local authorities, and I believe that the best decisions are often made by local government. Under the current emergency declaration, and we're still in an emergency, there is broad discretion that's given to these local authorities. We're going to be clear at a state level, and we're going to emphasize personal responsibility, because I think I trust Montanans to do the right thing for themselves. And what we've done today is we've laid out a clear path to remove this mask mandate on a statewide basis, given the two triggers that we've identified here.
One of the biggest actions of Governor Bullock's November directive was to both enact a 10 p.m. closing time for bars, restaurants, and casinos, as well as a 50% capacity limitation. Is there any plan at this time to repeal those aspects of his directive back in November?
So that's a very good question. This is one of the probably one of the most passionate things we heard from businesses across the state. And what I can say at this point is stay tuned. We'll have news within days on some of those business restrictions.
Does adding these two groups that you want to focus on getting the vaccine to, does that change or remove anybody that was already in the existing 1A or maybe in the 1B priority? Are there any shifts elsewhere?
Yeah, so with this shift in philosophy to focus on the most vulnerable in our communities, nothing changes in 1A. 1B is replaced by this definition that we've shared with you today. And again, their essential workers will move to 1C. And the goal, and I think it's something we could all agree on, we want to minimize deaths and hospitalizations from this virus. And if you're a teacher and you have an underlying health condition, we've just accelerated access to the vaccine. If you're an essential worker and you have an underlying health condition, we've just accelerated your access to the vaccines. We're going to get the people that are most susceptible vaccinated as quickly as possible, and that's going to be our priority across all the groups that need to get access.
Our next question is from Mara Silvers with the Montana Free Press. Mara asks, Governor, when you say protecting the most vulnerable, do you plan to increase the vaccination timeline for incarcerated people?
Yeah, so this is a good question. Anyone who is in congregate care, whether it's prison, nursing home, or whatever, if they meet these qualifications, we've just accelerated vaccine access for them. So if there's someone in Deer Lodge who has an underlying health condition, this directive means the vaccine is now available to them. Again, it's a uniform policy across the board to focus on the most vulnerable. Is there another online question?
Yes. We have another question from Maritza Giorgio with NBC Montana. Maritza asks, today's numbers are the highest we've seen in 4 weeks, with 30 new deaths on the dashboard. Are you concerned about what's to come in these few weeks after the holiday?
Yeah, so I'll be clear. I mean, we are not out of the woods yet. We continue to see deaths. We continue to see infections. That's why it's imperative that we continue the rollout of this vaccine and focus on the most vulnerable in our communities. Any question? Yeah.
Governor Jonathan Amberian, Montana Television Network. I just want to be clear. Are you expecting to make any changes to the mask mandate before you get to this point with additional vaccinations and liability protections, or is it likely to stay in place as is until then?
Okay, there are many restrictions in place. We've been very clear. We're going to work towards rescinding these restrictions over time. The path to removing the mask mandate is conditioned on two things: getting the vaccine to the most vulnerable, and secondly, getting this protection for small businesses and nonprofits and schools. Is there one? Okay. Yes.
Slightly different topic. During today's House Appropriations meeting, a Department of Commerce official said that the department would be giving some emergency housing assistance money back to the state budget office because they couldn't get it out by the statutory deadline. I was just curious if you have any comment on that.
You know, I didn't see the testimony, but I'd be happy to get you a statement.
Do you have specifics of what those underlying health conditions would be that would qualify people? And then I'm wondering too how that's documented. You know, does someone have to have a doctor's note, or kind of how that would work?
Okay. We worked with the staff at DPHHS, and maybe General Quinn can comment on that.
Yes, so Holly, the Health Alert Network, that notice that goes out to all public health departments will contain the list of those severe underlying health conditions. And then there's always the ability of a doctor to say, I have a specific concern, I'd like to do a vaccination. So it's fairly inclusive of what will be provided.
And that notice will go out this afternoon with those conditions itemized. Yeah, no problem.
I have a question from Matt Bolts with Kaiser Health News. His question is, Governor, would you oppose counties and cities from imposing their own mask mandates when the state mandate is rescinded?
So as we discussed earlier, local authorities have broad authority during a period of emergency. And they have discretion to make those decisions. I think often, generally, a one-size-fits-all policy doesn't work for the whole state. We have counties with very few infections. Those local authorities might choose to relax restrictions more quickly, and other counties need to take additional precautions. So they have the authority to do that. We're going to make clear the guidelines so that we have clear direction for businesses and we can get back to normal as quickly as possible.
Question from Renee with the Sydney Herald.
Okay.
Renee would love you to speak to the safety of the vaccine and why you're confident in the science behind it.
And Renee, I appreciate you raising that issue. Having spent time on the healthcare subcommittee, having discussions with Secretary Azar, reviewing the data with the COVID task force, I'm confident that we have a safe and effective vaccine. That's why when my name comes up on the list, I'm going to get vaccinated because I think it's going to protect me, and why we're prioritizing getting this vaccine to the most vulnerable now so that we can get to a better place together.
From Peter Christian with KGVO. Peter asked, as far as ending the mask mandate, are there specific COVID numbers that must be met, such as reducing the COVID-19 numbers to 25 per 100,000 individuals, which is what they're hoping for in Missoula?
Yeah, so we've laid out the criteria today. We are going to repeal the mask mandate when the vaccine is more broadly available to the most vulnerable in our communities, and when I get protection for small businesses and nonprofits against lawsuits. Those are the two conditions. I hope to do that in weeks, not months, and we'll keep you posted. Yes?
You mentioned you want to switch to incentives and not mandates. Is there a reason you can't do both?
We have a very serious health crisis on our hands. I've said repeatedly, this is the #1 issue for the state of Montana. We need to make sure the guiding principles here are protecting the vulnerable and also charting a course that helps us get back to normal. We've had policy that has been predominated by mandates, and I've been clear, we're going to shift to more incentives and personal responsibility. We're not going to rip the Band-Aid all off at once. We're going to make a transition here, and today's announcement, not even a full day into my term, clearly lays out how we're going to get vaccines to the most vulnerable so we can get to a better place as a state and get back to normal.
I don't know if this is best directed for you or General Quinn, but I'm wondering in terms of the vaccine rollout so far, where have you guys found the best successes and people most willing to be vaccinated? And where have been some of the biggest challenges, both logistically in getting the vaccine to people, and what populations have had more resistance?
Yeah. General Quinn, if you could comment just on the distribution and how it's being received. And
Yeah, so Holly, I may not caught all of it, but good acceptance from frontline medical workers as we see it across the board. Actually, what we're getting reports out of our tribal communities is there's good acceptance out amongst the tribal communities, certainly have been hit hard during this. And so I think as this rolls out, the focus on most vulnerable, I think we'll see that uptake increase as well. Does that, and then distribution-wise, so the Pfizer, as you recall, went out to the hospitals that had the ultra-cold storage. CVS, Walgreens that are doing the long-term care assisted living facilities also have the ultra-cold storage, so they were given the Pfizer. And then the Moderna is going out because it's 100 doses in that case as opposed to the 980. The Moderna is going out to some of our critical access hospitals and other locations that maybe just didn't have that large caseload that they could give it to. Did that answer the question? Thank you. Thanks, sir.
thank you for being here today. We'll stay in touch.